The recording has started. Thank you for being here, Dr. Mary Ohmer. Dr. Mary Ohmer is going to be giving a presentation today for our Common Read program. The title of her presentation is called Community Support for the Prevention of Violence and Promotion of Mental Health. Dr. Mary Ohmer is an associate professor and chair, community organization and social action specialization at the University of Pittsburgh School of Social Work. Dr. Ohmer received her PhD with distinction and her MSW and MPIA from the University of Pittsburgh and BSW from Gannon University in Erie, Pennsylvania. She has over 30 years of experience in community organizing and development and over 15 years in community engaged research. Dr. Ohmer is on the board of the Association for Community Organization and Social Action and has leadership roles in the Society for Social Work and Research in Community and Neighborhood Research. She is the academic co-lead for the Policy and Place Committee for the Pittsburgh Study, UPMC Children's Hospital, Pittsburgh, and is on the Internal Advisory Council for Pitt's Community Engagement Center Initiative and the COVID-19 Community Response Task Force. She is also the lead author of Measures for Community and Neighborhood Research, the first book of its kind, to compile and synthesize measures for community research. In addition, she was on the leadership team and a contributing author to the CSWE's Specialized Practice Curricular Guide for Macro Social Work Practice. Dr. Ohmer is currently conducting community-based participatory intervention research projects in several neighborhoods in Pittsburgh. 2 projects are focused on preventing violence and promoting community health, and a third project focuses on increasing resident civic engagement to influence equitable development. These projects are engaging youth and adults and are in collaboration with community partners. Go ahead, Dr. Ohmer. Thank you.
All right. Thank you, everybody. It's great to be here, and I appreciate the invitation to share what I've learned over the many years doing this work. So I'm going to share my screen. I'm going to talk to you about one of the projects I've done. It started in, can you see that? The screen? The slides? I just want to make sure.
Not quite yet. We can't see them until you start sharing.
Okay, let me see.
So if you
select a slide to begin sharing. Oh, here we go. Awesome. Okay, there we go. So this is a project that I'm going to talk to you about that started in Georgia when I taught at Georgia State University for about 10 years in Atlanta. And I'm going to talk to you about how we started this project and what we're doing here in Pittsburgh. But also want to just give you some sense of what collective efficacy is, why it's important, and talk to you about the different phases in the intervention, how we did it in Atlanta and what we're going to be doing in Pittsburgh. And then for this, the framework for research I use is community-based, participatory, community-engaged research. And I think that's important to also highlight. And then just some lessons learned doing this during COVID and during this pandemic. So let's do. All right. So collective efficacy is a fancy way of saying neighbors trust one another. They know each other, they have connections, right? And because of that, they're willing to, address neighborhood problems and also step up when they see kids in trouble or they see somebody's out of town watching their house, protecting, other people's, property while they're away, stepping in when someone, has a fire or has a catastrophe, or there's some, something happening in the neighborhood that, people want to park or they want their parks improved, etc. So it's like, I know I grew up in Erie in the city on a small street, and we all a lot of us knew each other. My parents certainly knew people. And we played with the kids. You know, kids play with each other. In fact, we played kickball in the street. And, you know, I knew when I was like out too late, my neighbors were watching out for me and like, okay, aren't you supposed to go home? And oh, you know, just are you okay? And just making sure that you were okay. And just, you know, I always felt like my parents really cared, but my neighbors cared about me. And so when that happens, people are then willing to step up and do things together. They have the connections. They believe it's important. So, but this is a really important concept. And, you know, when I was doing organizing, community organizing, it really, this was what we often worked with neighbors to like identify ways to strengthen relationships, strengthen their ways that they could intervene. But I didn't know it was called collective efficacy until I became an academic. So why is it important? There's a lot of research out there on this social process called collective efficacy. It shows it lowers crime and violence. You know, this is neighborhood violence, but also intimate partner violence, juvenile delinquency, you know, all forms of violence. But it also improves health and well-being. So if there's more collective efficacy, people have better health, mental health outcomes, self-rated health, etc. So that's why it's important. And I met some of the people that were involved in this kind of basic research, showing the importance of collective efficacy. And I was like, the organizer in me said, well, we should really do something to make sure there's enough collective efficacy in neighborhoods, right? How can we work with communities who say, you know, who have faced crime, violence, you know, problems with community mental health? How can we help them? And so to me, that was really important. And just understanding, well, how does it work? So in neighborhoods where there's more poverty, there's more instability, there's less social ties and capital, and there's less infrastructure supporting the prevention of violence, that impacts collective efficacy, right? So the more social networks, social capital, the more collective efficacy, the less collective efficacy. And also then you can see that collective efficacy leads to all these positive outcomes that I just talked about. So if you look at how does the literature define neighborhood collective efficacy, and that's the social connections is called social cohesion, and that's mutual trust, social connections, relationships, you know, including friendship network, civic engagement, participation, faith-based engagement, and then informal social controls, really the process by which people intervene, right? Keep an eye on their neighbor's property, or they question strangers and residents about suspicious activities. So it's both of those things together. So what we're trying to do in the projects and the interventions is really, you know, facilitate trusting and strengthening relationships among youth and adults, changing community norms, or actually improving community norms to support the prevention of violence and promote community mental health and well-being, and help to increase residents' ability to restoratively and safely intervene in neighborhood problems, right? So we're doing this in collaboration with community partners. And in Pittsburgh, we're working with a group called the Fineview and Perry Hilltop Citizens Councils. We have a center called the Center for Interventions to Enhance Community Health that's funding this. And so where's Perry Hilltop? Fineview is the north side of Pittsburgh, if you know Pittsburgh. That's where it's located, where the little red box is. And you know, there's 91 neighborhoods in Pittsburgh. So the other project I do is over on the other end, in the east end, in Homewood. All right, so what are we doing? We really are trying to build on what the community already has been doing. And they developed a community plan in 2018 that had several goals and objectives. And several of them actually relate to this project directly, to address public safety, to improve community connections among youth and adults, and to improve community mental health. Those are all goals in their plan. It's really important if we're coming in to communities, is to actually work with them in collaboration to address the goals they already have. And how does this project support that and do that? And we had a lot of conversations over the years to talk about that. But also my students do community projects, master's students. And one of the community projects they did in 2017, 2018 was actually support the Perry Hilltop Citizens, Fondue and Perry Hilltop Citizens Councils to do help to survey residents, and they also really helped with, you know, a lot of the community engagement around this plan. So the project really builds also on the intervention I talked to you about in Atlanta that I did. It started out as a training program that I did with colleagues in criminal justice and in social work. And then it turned into a 3-phase program, which I'm going to talk to you about today. And this project we did evaluation of, and of the participants, and it showed that they increased their engagement and connections in their neighborhood and their level of trusting social relationships with their neighbors. They were significantly more likely to intervene in neighborhood problems, and they also improved their attitudes, norms, and values about intervening. So the project has 3 phases. Phase 1 is community organizing and mobilizing. Phase 2 is a training to facilitate collective efficacy. And phase 3 is a community project that training participants work with the wider community on to address the issues they learned about in the project and in the training. So, example from Atlanta. So we partner with a local community-based organization in a neighborhood called Reynoldstown, very close to Georgia State, actually, University. And we worked with them to gather information about the community. And we, wait, did I do that? Yeah, okay. I am going to go back because I think I might have gone too far. Sorry. I have to tell you what phase 1 is. Phase 1. Okay. What is phase 1? There. Can you see that? Phase 1 is organizing. So we gather information from stakeholders and residents about what's happening now to address these issues. We meet one-on-one and in groups with residents and stakeholders to share information and get feedback. We integrate the community's ideas into the project, and we identify participants. So as I was saying, in Atlanta, we had this really strong partnership with a community-based organization. We met with residents participating in their programs. There was a youth group who developed the name for the project, and that was called Lead, Inspire, and Unite to Prevent Crime and Violence in Reynoldstown. And that went on all the remaining flyers and any kind of information that went out about the project. We met with the seniors in their community engagement program and with residents participating in their housing programs. We also met with community organizations, you know, and stakeholders and other residents through a civic association, through faith-based groups, and at the local coffee shop where we posted flyers, and then also at local businesses where we posted flyers. We had also several information sessions where residents learned about the training and provided feedback. So that's phase 1. So that took about 3 or 4 months to do that. And we got a lot of really good information, and we ended up having then in phase 2, which was the training program. This phase 2. All right, with the training program really has, it's 6 weeks, and it focused on identifying the community characteristics and values that support and hinder safety and mental health, and facilitate and strengthen trusting relationships between the youth and adult participants themselves, but also between them and their neighbors. And we also did a lot of role playing and discussion about using these restorative practices and nonviolent intervention skills to intervene in the kind of problems and issues that were in their neighborhood, specific to their neighborhood. We also engaged in external resources, and we tried to foster not only youth leadership development, where the youth took the lead on specific areas, but also collaboration between youth and adults. So session 1 was really looking at building on the strengths. It's an asset-based approach, right, to working with communities, looking at what were the strengths in the community, how could we build on those for this project. There were 24 youth and adults in this training program. And in the session 2, they looked at collective efficacy and its effects on crime and violence prevention. Sessions 3 and 4 were really about the strategies, learning those and practicing those, and then also really thinking about ways to use communication in a nonviolent, respectful way, and then staying safe. How do you stay safe if you're going to be intervening? And then how can community resources and then contacting those resources, including the police and other resources, be part of intervening? And then we discussed those ideas for their community project, which were developed throughout the training with community resources that the residents identified and invited to that last session. So in between the sessions, they had activities and they had all kinds of things that they did. So really, we reviewed the crime and violence data, but then there was something we did called Photo Voice, and I sent you guys an article on this. And this is where the participants went out in small groups and took pictures of things in the neighborhood they felt contributed to crime and violence, but also alleviated it. And then we had conversations over several sessions about the pictures, about what they meant, what were the gaps, where they felt like we could build on these strengths and to address these issues in our neighborhood. And the youth were given the lead and kind of developing, taking the ideas from the conversations and the training and developing and strengthening those ideas and presenting them back to everyone in the conversations and the training to really get down to a list of about 3 top projects that they shared in that last session with stakeholders. So I'm going to show you some of the pictures. So I'm going to show you some of the pictures of what they did for the Photo Voice. Okay. So, okay, wait, these were some of the things that they took pictures of that they felt contributed to crime and violence. So there were a lot of vacant buildings and vacant houses. Some of them were burnt down that were caused by a lot of people abandoning homes during the foreclosure crisis, which actually hit Atlanta pretty hard. And then people would leave things out for days and days that the garbage people wouldn't pick up. And so they felt this was contributing to crime. And then obviously these abandoned and vacant lots that were full of litter and where people would often gather for things selling drugs, etc., in the community. So but they also felt like there's a lot of strengths, right? There's a lot of strengths in our community. They talked about and showed pictures also of people they had made friends with, especially the youth, and that they felt that they were strongly connected to other youth and some of the adults in the neighborhood. They also liked this commissioned graffiti work. And there was a really interesting conversation between the youth and adults about graffiti. So the youth were like, okay with the most graffiti. The adults were like, I like the commission stuff, but not the stuff that randomly happens on the sidewalk or street. So it was really interesting the way they shared their perspective about that. And then this is a mural that they also really liked from the Reynoldstown Civic Improvement League. So those pictures, so there were many pictures, as you can imagine, and each group presented, here's what we think are the things that help neighborhood be safe or not safe. And through all those conversations, they honed down, and the article I sent you talks about the process that was used to actually get them to the final ideas. All right. So phase 3 is the project. So based on a lot of feedback from the community stakeholders and then further discussion, the training participants get together and talk about, you know, what project they would like to do, and they weigh the benefits and the challenges and the strengths and weaknesses of the 3 final project ideas together. And it really is important that they think about, how does it demonstrate and apply what we learned? You know, how would this engage the wider community? Is this something that the community itself thinks is important? And does it facilitate collaboration, further collaboration, not just with the participants themselves, but other youth and adults from the community? So in this phase, the project ideas, again, they met came out of the training, and they honed in on the final one they decided on. And then the participants met for 4 months to develop the project while engaging in developing partnerships with key stakeholders. And the project funding was used to hire an artist to purchase materials, etc. for this. So the Civic League was a really important partner, not just the community-based organization that was partnering on this actual project, but on this community project. So they had a vacant lot. So they decided they wanted 2 things. They wanted something visible to like reclaim one of those vacant lots, because there were many, but also something to bring the community together, to build relationships. And so the Civic League actually had this vacant lot. They actually had site authority. They didn't own it, but they had site authority from the owner to do something with it, and they had not had the ability to do anything. And so this group, several people from the Civic League went through the training, and they decided, let's do something with this lot, and let's create a space, right, that is welcoming and that really speaks to the community. And it was a community art and garden project. They had an event that was attended by about 70 people inside and outside the neighborhood at that event to unveil it. And in the event, they also had residents. They had gathered stories from residents, and some of the longtime residents shared their stories about the neighborhood at the event. Their memories, basically, of all the connections they'd made, how they felt that these relationships gave them a sense of safety and community, how they worked together to address issues. And, you know, shared this with the group, had a question and answer session, and, you know, really talked about the importance of relationships. So it was this tangible, as you can see, lot that was redeveloped against this graffiti wall. This graffiti wall that I showed you in the first picture was a very, very long wall that separated the neighborhood from a rail station. So they created this stage. It was a map of the neighborhood, and they had on the stage identified neighborhood assets, things that they liked about the neighborhood. The youth really did a lot of the painting with the artist. And they created these little tiles for the stage. This was a space where they felt people could gather in a safe way. And we also did a little gardening. Some of it grew out much nicer than that. It took a while, but it looks really nice. And then here is what the sign says. So this community space is a gathering and performance place for residents to build relationships, hold community events and activities, and spread the message that neighbors can create a better community by leading, inspiring, and uniting one another. And they called it RAMP, Reynoldstown Alcove Memory Park. All right, so what are we doing in Pittsburgh? We're doing the same project. We're increasing the evaluation of our project. So we just evaluated the effects on the youth and adult participants from the training, right? Before the training, after, and then after the community project. Here we're going to, in the first phase, which we're actually in right now, we're going to conduct a community survey of 105 and Perry Hilltop residents at the beginning, right now, and at the end of the project, phase 3, community project, to assess neighborhood levels of collective efficacy, their perceptions of safety, their community mental health related to their exposure to violence in the community. We also added, because of all of the issues with the police nationwide, we also, the community wanted to add questions about their community's perceptions of the police. And the police actually were pretty supportive of that. The city of Pittsburgh has been a partner to this neighborhood, including the police department. In fact, we had a community advisory board meeting with this project Monday night, and the Dr. Heath Johnson, who does all the crime analysis for the Pittsburgh Police, presented crime statistics to our community advisory board. But it's really important, the information that we think is going to help inform the training in our project from this survey, but also understand if anything had changes neighborhood-wide from beginning to the end of the project. We're also going to look at the youth and community crime and violence data, and Dr. Heath Johnson, who met with us Monday, is going to help us with that. So let's see. All right, so what are we doing? How are we doing this? So I saw a really quick question about how do you engage the community? How do you get buy-in? You have to use community-based participatory research principles to do that if you really want to partner with them. So we together applied for funding. The community, the Fineview and Perry Hilltop Citizens Council and myself, we applied for funding together. The funding is actually being shared to support the project and their staff, right, to actually be a part of this project. And resources will be provided similar to in Atlanta to people who want to participate in the training, an incentive for them to do that, but also for the project itself. So that's the collaborative, equitable partnership piece, which is crucial. You can't come in also thinking that you know everything. You have to focus on knowledge that is local and collaborative. Co-learning is really, really important. Building on the strengths of the community. So we came in, we're building on the strengths of Perry Hilltop Fineview, all the things they've already done that are going to be fused into this project. Understanding the local relevance, understanding that there's multiple things that are, really contribute to the health and well-being of a community. And this idea about disseminating results to everyone and to the wider community is really important. So even with the project, the other project I'm doing in Homewood on equitable development, we're just now writing journal articles. We wrote a lot of other things to share with the community, workshops, an equitable development playbook, a lot of other community very oriented things that are not academic, that are really key to showing that you are really focusing on the community itself, that you're serious about equitable partnership and co-learning. So in this project, we have a resident-driven community advisory board. The people on that were identified by our community partner who has strong ties to the neighborhood. Again, this idea that we're trying to learn from one another and we're all building our capacity to do this. And that we're trying to also involve other community stakeholders and organizations, groups that work with youth, groups that actually address community mental health, groups that are doing violence prevention. We have been engaging them throughout this first phase. We are really trying to, again, deliberately integrate the community's goals and efforts into this project. Looking at that community plan, specifically understanding what's been done and how do we actually build on that. Again, youth and adults will be engaged as co-learners, right, throughout the training and community-based project. And again, this idea of constantly sharing information. So when we do this community survey, we'll have an event to share the results with the wider community, and then talk about ways and their ideas for how we infuse what we're learning into the next phase of the project. So we're going to do the same kind of evaluation we're going to evaluate the effects of the intervention on 30 youth and adult participants as well. So we're doing the community survey, but we're going to do the same evaluation, and we added several other things to this one based on the community's input that we're going to look at. We're going to try to engage 30 youth and adults in the project. So what have we done during COVID? So it's been a challenge. You can imagine, you're used to going in a community, buying food, having meetings, getting to know one another. We were in the neighborhood one time when it was warm out one day to do a community tour, especially for my doctoral student who was not from Pittsburgh and is working on this project with me. So, and I wanted her to get to know the partner and some of the CAB members. So what we have this CAB we have CAB co-chairs who meet with our team to plan the CAB meetings and to review and discuss our goals, methods, phases, stakeholder engagement that I talked about. They also were trained in, it's called the Community Partnered Research Ethics Training. It's for the Institutional Review Board. We all have to be certified to do research. This certifies community members and partners to do research with us. We also developed information materials on the project. Again, Dr. Heath Johnson, we've met with him several times. He presented again this week. And we developed and pilot tested our community survey. And our CAB is and we've talked about how we're going to collect the data virtually, an online survey we're going to use, how we're going to, get the survey out to people. The community partners, see, the beauty of having a community partner is they have the relationships. They have over 700 contacts of residents that they are going to be able to send this survey to. And hopefully we'll get 100 back. But and we'll pay people $10 to fill this survey out. So just working with them, they have the connections, they really care about this issue, and they have the relationships. So we are continuing to develop our team and collaborate, and also have connected this to the wider Pittsburgh study out of UPMC. We're also doing a project that is assessing child and youth thriving as a way to prevent violence. And so we've been connecting that project with this one as well. So this is pictures of us on our little neighborhood tour. So this is beautiful view of Pittsburgh from Fineview neighborhood on the north side. And then this is some of our cab members and staff. And then we went and we visited with this resident in her backyard and talked to her about the project. So that was a really great in October. It was really a nice day. So we hope to be able to do more as in person this year. So again, we focused on phase one because it can be done virtually. The community survey can be done online versus going door to door. We're doing Zoom versus in-person meetings. Again, there's less engagement, but we have to develop alternative methods, and we have done so far a pretty good job, but I think everyone's itching to meet together. And again, the training we know needs to be done in person. And so we are hopeful that we can do that either at the end of the summer or early fall. So what did we learn? We learned that, boy, they are some great neighbors, right? In this community, they are committed to addressing these issues. There's a lot of experience from this community partner and these residents, and it really results in genuine engagement by our residents in our cab. They have helped us inform the project in ways that make it very, very community relevant. We have deeper engagement by our co-chairs who we meet with more often. And one of them is a young African-American gentleman who runs a youth program. And another is actually a graduate of the School of Social Work MSW program who runs a culturally specific counseling program, mental health program in the neighborhood. So partnering with these existing groups that have been doing the work on the ground is really effective for collaboration. Again, helpful. The community connections have been helpful. The people already working on this, the staff of this community-based organization are trusted. The CAB has been great. The challenge is it is hard to engage over Zoom. Not everyone has access to technology. Sometimes they're on their phones, sometimes they're in their cars. It's hard, it's not the same as being in person, buying food, sharing a meal, and then talking together. So I think it's really important. Not everyone, is going to be able to be as present over Zoom. And we're missing, the opportunities of engaging residents in their own settings and environment. And that I miss most of all. So I saw there was a lot of questions. So I don't know. I'm going to stop sharing. There's my email if you have any questions. I'm going to stop sharing, and then we can, I don't know let's see where the questions are. Maybe Stacy, you can facilitate the questions.
So I'll read. Adam just posted a question. Adam wrote, being that many of these projects are mostly aesthetic community projects, do you believe they will be effective in substantially reducing violence and increasing safety? For example, the couch on the sidewalk was determined to make the neighborhood less safe. I'm curious as to how aesthetic projects address the underlying causes of community violence, such as generational poverty, joblessness, and dilapidated housing.
Okay, so they are only one piece of the puzzle, right? So one of the things that that happens through this whole process is, yes, they do one project together, but it does illustrate like what they learned in the training. But we're equipping people to actually address further problems in the neighborhood, to actually tackle the deeper, harder issues, strengthening the connections they have, and their knowledge and understanding of these issues helps them be better prepared to work together and then quite frankly, strengthening the connections to the external resources that impact these communities on these issues. That is a key place to start. So building their ability and their skills, right, to do this. one of the other key things is it has to connect to the goals the neighborhood has. So if it doesn't do that, it isn't going to go anywhere. If it does connect to the goals the community already has, this gets fed into those existing structures for doing that. So this Perry, Hilltop, and Fineview, the Citizens Council itself has task forces working on not only public safety, but also housing issues, employment issues, other than all the things that you talked about. And so this has to support all of those things that they're already doing and help them with new skills, strategies, and ideas to do more. I hope that makes sense.
Oh yeah, thank you so much for the answer.
Jensen just asked, do you think this plan could work for a few different income level communities, or is it specifically geared toward a certain income level?
I think it could work for any income level, quite frankly. I think in neighborhoods and communities that are facing this range, the range from very low income to moderate income, communities. I think it could work definitely. I think one of the challenges really is what's the existing, is there existing community-based organizations that you can partner with? Because I can't just go into any neighborhood in Pittsburgh and say, oh, why don't you do this training with me? I can't do that. I'm not ever going to do that. So what is important is once I think you establish that partnership with one community-based organization, then others could follow. But also in communities that don't have those community-based organizations, that strengthening process also needs to happen if they want to tackle these issues. But also external resources, they need to be engaged in ways that you're influencing and advocating, but also trying to partner.
Are there any other questions? You are free to turn on your microphones if you'd like, and ask your questions directly.
I had a question real quick, just kind of on what I asked before. So there kind of needs to be a willingness, like intrinsically within the community you're working with beforehand for this to really work. You're kind of saying like within the Perry Hill, they have an administration, within their community that they're already trying to improve things, and then you guys can kind of come in and help them make things a little easier.
Yes, I think that's the best way it works. It doesn't mean that you can't do this in other communities. They have to just, if they aren't, if they don't have the capacity and they want to build the capacity to do this, then you might have to do some of that work first with them. That makes sense.
It does. Thank you.
Mm-hmm.
Any other questions? I'm not sure that there are any more questions. I just want to thank you so much, Dr. Ohmer, for your very informative and engaging presentation. As I mentioned earlier, this is going to have this, since it's being recorded, it's going to have a long-term effect on CCBC, and I fully appreciate that you were willing to join us today.
Thank you so much. I'm glad it was helpful. And please don't hesitate to reach out to me if anyone has other questions or if I can be helpful in any way.
Thank you, Dr. Ohmer. I really enjoyed your presentation.